Welcome to On The Beat, everyone. I'm over here with Dr. Robert Phyfer from the renowned Brooks Eye Centre, and today we're talking all about glaucoma, and we have the man that is going to give you all your answers. Welcome to the show, my friend.
How are you?
Appreciate you coming back again. All right, to begin with, help me understand, and everyone sitting at home, what actually is glaucoma?
Glaucoma is a condition of the optic nerve, like we talked about in the last lecture about the macula. The optic nerve is just a structure in the eye.
Okay.
And I won't muddy the waters, but there's a lot of different types of glaucoma, but essentially the pressure is too high in the eye, and that nerve slowly dies away. And it causes side vision loss, not central, it causes your side vision to go.
Okay, so is that when we say that we have tunnel vision?
Yeah, yeah, pretty much. But
Okay.
just because you may have that, and it doesn't mean you have glaucoma. So you may get tunnel vision sometimes, standing up too fast, things like that. But
okay, so you said to me that you lose your side vision. What is a symptom that you may have glaucoma and not even know about
sometimes you may not even know it.
Yeah.
It's very rare. Sometimes it will cause mild central loss, but you may
Okay.
not even know it because most of the time it is off to the side. And that's why it's so important to come see us, because we're screening every patient that comes through our doors for glaucoma. And there's a lot of different ways we can screen people easily to see if they have the risk factors for glaucoma.
it? Hereditary?
Yeah, there is a genetic link to it for sure.
Really?
Yeah.
Okay, now, is it preventative?
There are certain things that, there is a study they did with 60,000 people that said that exercise can prevent glaucoma.
Really?
So I tell people to get active, start walking more, exercising more, and that has been shown to prevent the progression of glaucoma. Yeah.
Okay, so what are the treatments when it comes to having glaucoma? And I would assume there's different levels of glaucoma?
Correct.
And I would assume it gets worse as you age or don't treat it.
Correct.
I've given you lots of questions there.
The treatments are simple. At the end of the day, we got to get the pressure down. So usually we will start with drops. These drops get the pressure down in the eye. There's a few ways that they work. One, they open the drainage system, so they'll let more fluid out. The second way is they can decrease how much fluid is made. So we can decrease the pressure in the eye, let more oxygen get to that nerve, and breathe better than it was breathing before when that pressure was too high.
Okay.
And that can save a lot of vision.
Okay, so I just want to understand myself as well. Explain to me, you said that you're draining, okay? You're letting the fluid or the swelling?
There's no swelling, but there's fluid in the eye always.
But do we feel it?
You don't feel it unless your pressure gets to a certain level.
Right.
So most people don't even feel that the pressure is up. You could come in with a very scary pressure, but you would have no clue your pressure is elevated until you see us and we check your pressure.
Okay, I come into you for a normal yearly checkup for my eyes. Do you do a different type of procedure to check that you've got glaucoma?
So everyone that comes in, we screen them for glaucoma, and we do that a few ways. We check the pressure. I'm always asking if they've got a family history of glaucoma, and I'm always looking at their optic nerve. So if their pressure's up, if the pressure is elevated, I'm going to go on and do a glaucoma workup, and we're going to do a scan of the optic nerve. We're going to check their side vision to see if they're missing any of their side vision. So the scan, once again, kind of like an MRI for the nerve, it'll show if there's any damage to the nerve. If there's damage on the nerve, then some of the side vision will be missing on the visual field testing.
Interesting. I want to probably ask you a basic question. Are these tests part of your insurance?
Yeah. Oh, yeah. And this is a medical condition. Medical insurance pays for these every single day.
Really?
Absolutely.
How often should one be having their eyes tested?
You should have your eyes checked every year.
Just once a year?
Mm-hmm. Just to make sure nothing's changing. Just like your blood pressure goes up and down, your eye pressure goes up and down. This is the silent blinder. This is the one you don't know that's getting you.
Very quickly, worst case condition, blindness?
Yeah, you can go blind from glaucoma. We've got a few patients that have gone blind from glaucoma, but the drops prevent it getting that bad.
Okay, gotcha. If you want to find out more information about Dr. Robert Phyfer and Brooks Eye Centre and their incredible team over there, give them a call. All the information's up on the screen. Back after this short break.